Hello again. I'm Dr. J.C. Smith, chiropractor in Warner Robins, Georgia. And today let's talk more about this onslaught of spine surgeries that only seems to be getting worse and not better, despite all the research showing that the bad disc theory has been debunked. Experts now in other parts of the world are coming out really critical. For example, in Australia, they called for a moratorium on back surgeries 2 years ago. There was another neurosurgeon from down under who said only 5 to 7% of back surgeries are actually necessary. But in America, which does 5 times more back surgery than the United Kingdom, it's the most expensive surgery, and you don't have just one. People know that. You're going to have 2 or 3. Doctors are making a killing. So what can you do? First of all, just because you have a bad disc, it doesn't mean you need surgery. As I've mentioned before, ruptured discs are not even always a pain. This was a study done in 1990 that was confirmed by the Mayo Clinic. Years later, in 2014, after 30 years of watching these people get cut upon, they finally compiled a lot of research showing that asymptomatic patients also have bad discs. It's remarkable. Asymptomatic means no pain, no problems, right? You just have some kind of disc abnormality. But as I've mentioned before, a bad disc is totally secondary to the mechanics of the spine. Stop thinking that the disc is the only thing in the spine you need to be concerned with. The spine is a weight-bearing column, just like your legs bear weight. Your arms don't, but your spine does. And the disc is just a shock absorber, some call it a spacer, but it does nothing until the mechanics of the spine are so altered and then compressed from prolonged sitting, falls, bad posture, that then the disc will bulge. It'll swell like a sprained ankle. If you misalign the mechanics of the joints in your ankle or your knee, it's going to swell. It doesn't mean you go in there and start cutting things out and fusing it. For example, this Mayo Clinic study, this consensus showed by the time you're 50 years old, there's an 80% chance you're going to have disc degeneration, but you have no pain. By the time you're 70 years old like me, there's a 93% chance you're going to have disc degeneration, but you have no pain. And the same for a disc bulge. When you're 50 years old, there's a 60% chance you're going to have a bulging disc. Now, any spine surgeon worth his salt is going to say, oh, that proves you need my disc surgery. And what do? They don't realign you. They go in there and fuse you in a misaligned position. Even if they do just a discectomy where they shave it, you're still misaligned. You still have the compression problem. So they're dealing with a secondary problem. Again, the only time you really need surgery, according to the experts, is when you have cancers of the spine, fractures, disc infections maybe, or a serious neurological problem that just doesn't respond to conservative care, which is what the guidelines say to do first. Conservative care, by the way, doesn't mean right-wing politics. It means non-drug, non-surgical care, like chiropractic, physical therapy, acupuncture, massage therapy, yoga, tai chi. These are all the things, because whenever you restore motion and better alignment, people feel better. Obviously, some methods like what we chiropractors use works better than other things, but nonetheless, long before you succumb to surgery, even if you're in a lot of pain, don't fall for it, because they're finding now it's really a scam. It's the best kept secret in the medical world, and it's also the #1 expense in the medical world. For example, all those MRIs people are sent in for, they're calling for a moratorium on those, because again, as this study from Stanford says, MRI abundance may lead to excess in back surgery, Stanford study shows. And again, all they're going to do is say, oh, you got a bad disc. And like I say, percentage-wise, most adults by the time you're 50, like 80%, will have a bad disc. But again, you may have no pain. The pain is generally associated with the joints of the spine. Again, most people don't know that your spine even has joints. If I were to give you an anatomical quiz, how many vertebrae are there? You know, some of you know 24. How many discs are there? 23. Do you know what the sacroiliac joint is? Which is where a lot of low back pain starts. There's not even a disc there. It's these 2 side joints right here. It's just bone butting up against bone. And when that slips 2 millimeters, you have a back attack. But it doesn't mean you need surgery. Although some docs may want to put a pin in there, it doesn't work, so then they go back and take it out and you get charged secondly. But nonetheless, what you need to do is find a chiropractor, and there are chiropractors who deal with spinal rehabilitation, not just short-term acute pain, what I call a pop in a prayer. There's plenty of those. But there are others that deal with spinal traction. The Cox method is very well known. Spinal decompression, like we have here with the DRX. And then there's chirobiophysics. These are docs who are involved with actually trying to restructure your spine back to a norm. And that includes a lot of exercises similar to what we give out. But this is becoming an epidemic, so much so that the Medical Times, which is a very well-known journal about science, health, and finance, this is their latest one on January 21. That's not long ago. That 9 more physicians charged in a $950 million spine surgery kickback scheme. That's the top title. The subtitle is Spinal Fusion for Chronic Low Back Pain, a Magic Bullet or Wishful Thinking. And again, they're questioning this. Conflicts of interest through consulting ties and other relationship with device manufacturers, those are little screws they put in people. Doctors now started becoming investors in spinal implant. So they're profiting 2 ways, by doing the surgery and then putting all that metal in you. There are at least 20 states in the U.S. with multiple active physician-owned distributorships which supply devices to hospitals, which is why hospitals love doing back surgeries, even though they're not necessary. This is also why hospitals don't like chiropractors on staff. As I was told, you're too cheap and too effective. But nonetheless, it's only getting worse. Despite the absence of good evidence to support the efficacy of spinal fusion for chronic low back pain, the rates of spinal fusion has rocketed in recent decades. This has raised concerns about conflicts of interest and unethical behavior among healthcare providers, spine surgeons. Accusations of kickbacks to spine surgeons from medical device industries have made headlines in major newspapers in the United States in recent years. And it's only getting worse. We see it right here in little Warner Robins in Middle Georgia, which Macon happens to be the back surgery capital of the state of Georgia, because the base, Air Force Base, sends everybody in for back surgeries. They've had a boycott out there for 20 years, as long as I've been here, and as long as chiropractors were made available in TRICARE and federal women's comp, we never get referrals. They refer everyone in to pain clinics and the back surgeries. Luckily, the VA now has started sending more people to chiropractors, but for many years, they wouldn't until the veterans. Now, these are people that have a lot of back pain from old wars that have never been treated. They have a lot of PTSD from trauma. And what do? They're stoning them on opioids, which you may know is medicinal heroin. So they had a policy years ago that's changed of late. But for a while there, before you as a veteran can come see a conservative, non-drug, non-surgical provider that works better than drugs, back shots, and surgeries, they made you go have steroid injections and take opioids, heroin. And I used to tease these guys. I said, if you're in the NFL taking steroids and doing heroin, they'd kick you out. But here the VA made you do it before you can come see me for a better non-drug solution. That's how ironic it is now. I mean, they're out of control. Drug shots and surgery is all what the medical world wants you to know about. But none of the guidelines say that. That's a last resort. The first such guideline by the U.S. Public Health Service, Agency for Healthcare Policy and Research, acute low back pain in adults, it was at the top of the list after they did this 2-year study of thousands of studies. It was amazing. Spinal manipulation was at the top of the list. Then ice and heat and NSAIDs. They wanted to get people off the hard drugs. But do you think the medical world follow that? Hell no. MDs don't follow guidelines, they follow the money. And the money is drugs, shots, and surgery. So don't listen to your MD. He's just going to lead you down that Alice in Wonderland, following the rabbit down the hole. Let's do the drug shots, do the MRIs, and then they find some bad disc. They say, oh, you need surgery. The same with epidural steroid injections, which are very expensive and very ineffective. I had a patient who had one in his neck. It cost him $4,000. I could give you a year's worth of chiropractic care for $4,000, And then the research shows not only are they ineffective, but the only reason you have 3 a year is they're so toxic. The steroids actually, they demineralize the vertebra and dehydrate the disc. So they're actually accelerating this whole degenerative process that we see when people come in who've had these misalignments for years. So really, everything the medical world is doing for 90% of these cases, ineffective, expensive, and dangerous. Nothing we do here will get you addicted to opioids. Nothing here we're going to do will demineralize your bones. Nothing we do in terms of surgery is going to leave you in a wake of disability the rest of your life. It's really amazing what's going on now, but this is the biggest scam in medicine, and they all know it, but it's the biggest money maker. So before you, or anyone you know has back surgery, come in for a second opinion. I'll be glad to share this information. If you want to learn more, you might come in and get a copy of my book where it's all described in there. Nonetheless, watch our other videos. If you have any questions, come by. Thanks, and I'll see you next time.